Hi, Virginia Bernal here, and I wanted to speak to you a bit about that sore that you have healing, that has been trouble healing on your face, and there's a chance that it could be some type of skin cancer. And there are a few cancers that are out there, such as the basal cell carcinoma, melanoma, actinic keratosis, the Kaposi sarcoma, also known as KS, and the squamous cell carcinoma. I wanted to give you a little bit of background on each one of these, as well as what causes them. The basal cell carcinoma is a tumor that comes from the epithelium and of the epidermis, the bottom layer, which is called the basal cell layer. So that's where it really bases from. To contract this cancer, you can get it from overexposure to UV light, such as the sun and tanning beds. Also having such characteristics as blue, green, and even gray colored eyes, freckled skin, having blonde hair, many moles, even close relatives who have skin cancer can contract this type of cancer as well. Melanoma is also one to be considered one of the most serious of skin cancers. It is considered to be uncontrollable when it comes to growth of the tumor, which actually comes from the melanocytes that are in your skin. And the melanocytes are cells that actually form the melanin, which is the pigment color of your skin, of the tint of your skin. Then there's also the actinic keratosis, which is considered to be a precursor, actually, something that you get beforehand of the squamous cell carcinoma. So meaning that over time, the actinic keratosis can develop into squamous cell carcinoma. Actinic keratosis is a red-pink patch that's kind of scaly and can also be caused by overexposure to UV light as well. Now, as for the squamous cell carcinoma, is a cell cancer that originates in the epidermis. It will be red and firm and uplifted from the skin as well. There's also a chance that it can metastasize and further along in the growth process, meaning that it can spread to other parts of the body, also causing damage there. And mainly gets there through either the bloodstream or the lymphatic vessels. That's also a path track that they take. The last form of skin cancer I wanted to talk to you about would be that Kaposi sarcoma. The cancer is actually caused by human herpes virus 8, also known as HHV8. Which attacks the endothelial cells that line the blood vessels. So this causes prevention of normal immune response called immunosuppression. There will be like purple or brown patches that you will see like on your feet that can begin to spread through the lymphatic system, which is a choice that it takes. Also, let's see. Those who are at risk, with mainly people with pale skin, lightly colored skin, those that have red or very blonde hair also have higher chances of getting types of skin cancer. Also, if you're very freckled or mold, those are also some people that will have a higher chance of gaining these types of skin cancers. Family members also that have had skin cancers, that gives you more of a higher risk as well. And those who, compared to those who have not had it in their family. Also check your body from head to toe for discolorations, rough spots, wounds that won't heal correctly, and scaly skin. Use a mirror to check yourself in areas mainly that are exposed to the sun, such as your ears, your face, your neck, your hands, your arms, your scalp. All of these places need to be checked well, especially if you do feel like you had overexposure to the sun, which is abnormal for you. There are a few different types of treatments of these types of cancers. There's the excision, which is the cutoff or the removal of the cancer, and then having the skin stitched up to put it back together. There's also cryosurgery, which is like a freezing of the cancer cells, causing them to die. And it's a type of treatment that is used in all kinds of cancers that are not very deep or large in size. Also, Mohs surgery, which is it was usually done on cancers that are on the face or the nose or the ears. There's the removal of the layers and layers and layers until the cancer is no longer present on the skin. There's radiation, which is also used to help treat types of skin cancers. Usually they say it's used for the basal cell cancer, which is truly, which cannot truly be removed with surgery. So they choose radiation as a good choice to remove this type of skin cancer. There's also, lastly, the chemotherapy that can be done to help target these cancers that spread to other parts of the body, such as the basal cell cancer. Also, the best ways to help to avoid such risks of getting cancer are spending less time in the sun. Always use sunscreen. SPF 30 they have 40, 50, and 60 out there, but SPF 30 is the best. Let's not get crazy. And at least if you know that you will be out in the sun for long periods of time, please use sunscreen on such areas as your ears. Some people forget that. Your neck, your hands, your arms. Try wearing hats or long sleeves, maybe even pants, to try to to protect your skin as best you can. Also, try to avoid places that are close to water. Also, such things as sand, heavy light, concrete, white painted areas. All of these are reflectors for the sun, for the UV light, and that reflects from those surfaces back onto your skin, causing the damage of skin cancer that could happen in the future. In tanning beds, try to avoid them at all costs. There's a high chance that skin cancer forms more whenever you are using a tanning bed than you would in the sun, using the sun itself. So those are my recommendations and a bit of information on some background of skin cancers and some treatments that would best to help you better understand what you may be going through. And if you have any questions, please let me know. I'm always here to help, and thank you.